Hi, my name is Gutama Wadai, and today my PowerPoint presentation that I'm presenting is called Black Men's Mental Health, Maintaining a Balanced Life. So before I start my presentation, I'd like to do a land ancestral acknowledgement. I would like to start by honoring the land that we are on, which has been the site of human activity since time immemorial. It is the traditional territories of the Huron-Wendat, Anishinaabe, the Chippewa, the Haudenosaunee Confederacy, and more recently, the Mississaugas of the Credit River First Nations. Ontario is covered by the 46 treaties and our agreement and is home to many Indigenous nations from across Turtle Island, including the Inuit and the Métis. These treaties and other agreements to peaceable share and care for the land and its resources. Other Indigenous nations, Europeans, and newcomers were invited into this covenant in the spirit of respect, peace, and friendship. We're all treaty people. Many of us have come here as settlers, immigrants, newcomers in this generation or generation past. We are mindful of the broken covenants and we strive to make this right with the land and with each other. I would also like to acknowledge those of us who came here forcibly and involuntarily, particularly as a result of the transatlantic slave trade. And so I honor and pay tribute to the ancestors of African origin and descent. So my agenda for today's presentation, I will be talking about Black males' voices need to be heard, social determinants of health, the stigma associated with seeking help, and the fight against racism. Why we need to improve health and well-being. 18% Black Canadians represent 2.9% of the overall Canadian population, but represent only 18% of Canadians living in poverty in Canada, according to Statistics Canada 2009. Also, people of Caribbean, East-West Indian origin in Ontario have 60% increased risk of psychosis, whereas Black women are 43% more likely to die from breast cancer than white women. And finally, in 2012 report by the Wesley Institute found Black immigrants in Canada were 76% more likely to assess themselves as unhealthy than other racialized groups. So this is alarming statistics, and unfortunately, not everyone has these up-to-date numbers. It's something that future research needs to focus on. So next topic, it will be the social determinants of health, which leads to poor outcomes. The study of Black men's health remains an under-examined frontier with little in the way of funding or will because Black men are not viewed as sympathetic and because so few go into health research profession. Basically, to walk through the world as a Black man like myself is to be simultaneously hyper-visible and invisible, under surveillance, yet never really seen. This is why Black male voices need to be heard. Whether we're suffering silence, this leads to experience of neglect. We also are hurt in pain, suffer from hurt and pain, and this needs to be acknowledged. We also go through sadness and grief, which is a source of our pain and trauma. And we get overwhelmed, the feeling of being left behind. So Black men are dealing with mental health challenges in silence and with shame. So as you can see from this PowerPoint slide, there's a bunch of feelings. Anger being the most broad one that you see on the map here. Helpless, grief, shame, sad, sick, anger, disheartened, scared, pain, despair, just to name a few. It may be hard to believe, but Black males do experience a mixture of emotions such as anger, and like I said, sadness, and all the other feelings above. Obviously, the more of these feelings one has will lead to being easily distracted and having a difficulty time concentrating. This wide range of emotions responses does not cause impairment, but if it's not a recipe for success. Social determinants of health leads to poor mental health outcomes for Black males. Quick stat, 38.3% of Black Canadian residents with poor or fair self-reported mental health used mental health services between the years of 2001 and 2014. Once again, we need more up-to-date data for this specific group. We know that systemic inequity is what leads Black males to not seek mental health support. These life circumstances repeated over years and decades cause a deterioration to a person's mental health. These barriers include financial challenges, such as economic hardship, loss of a job, loss of insurance, not able to pay for prescriptions or visit a dental office on a regular basis. These stresses are enormous as Black males become conditioned to believe that there is no room for upper mobility. Black racism here. As a Black man, we are always consciously aware of the skin that we are in. It's the skin that we have. No matter where we are at, people always respond to our Black skin. When we hear the word racism, everyone automatically thinks about name calling or being discriminated because of one's skin color. However, when you experience racism on a frequent basis, the stress of this takes a huge toll on the body and mind over time. When we as Black men go through in our everyday lives, we always have to be constantly vigilant. We have to navigate the racial microaggressions in everyday interactions like going to the grocery store or mall and experiencing hyper-surveillance. This also includes the fear of dangerous outcomes that can result in death, such as driving while Black or even as simple as bird watching in a park. The next box is unemployment and underemployment. The struggle to break out of poverty is a challenge to maintain good health. Studies have shown that prolonged periods of unemployment and underemployment leads to shorter lifespans. Black males have much higher rates of unemployment and underemployment when compared to other members of society. There are systems that are designed to keep certain people in poverty, whether it's living in poor housing neighborhoods that have a lack of access to grocery stores and quality education. Living in these neighborhoods triggers this fight or flight response. There are systems designed like the school to prison pipeline to keep Black males failing and further marginalizing them to certain positions in our society of either being in prison, unemployed, or underemployed. The next box here is physical health and illness. Black males avoid going to the doctor's office. They only seek medical attention when it's absolute emergency. We need to remove this fear. There's a culture in the Black community that Black males only trust Black doctors. We need to work on increasing awareness for health professionals to do a better job on building deeper relationship with their Black male patients. Because of this misunderstanding, Black males are not able to have open discussions with their doctors pertaining to their overall health. Lastly, family dynamics and romantic relationships. The more they succeed, the more responsibility they feel to lift their families and communities with them. And with that comes more stress. Likewise, the more Black males fail, the more likely they will isolate themselves from the people that they love the most. Regardless, family dynamics and romantic relationships, whether good or in bad time, will always add to their chronic stress. So in this slide, we're talking about the increased mental health needs. The feelings that I hear all the time, I'm tired, frustrated, and upset. So this is the first one is called the superhero complex. It is the principle of helping others to reduce or solve their conflicts. It becomes a superhero complex when this desire to help people becomes a compulsion to do so. They want to impress other people rather than first to focus internally on their own problem. So this again leads to why they're tired, frustrated, and upset. Feeling burnt out. This is due to feeling the pressure of constantly calling out racism and advocating for the Black community. Neglecting to care for oneself. So self-neglect is the opposite of self-care, basically. The pressure to maintain certain standards directly affects the risk of overextending themselves and causes Black males to withdraw. Finally, this withdrawal leads to isolation, and this comes after a person experiences stresses and depression on a daily basis. The stigma of seeking mental health. Black males are raised to keep their emotions inside. I was raised to keep my feelings and thoughts inside. We are told to deal with it internally by ourselves. Then, as we hear since we're a child, man up. No one person can handle all their problems on their own. The truth is that Black males are not all alone, and they need to find people that they trust to share what's on their minds. It's a multifaceted problem. We need to first take off the mask because Black males live their lives behind a mask. We do not tell the truth when it comes to our overall mental health. The need for culturally competent mental health support. This is due to the lack of representation in the profession, which leads to not understanding Black culture. There's a difference in communication skills when talking to Black patients. Again, not being able to build trust with their patients. Black males dreading their therapy session, which leads to them not showing up for appointments. Finally, this is the last slide. And if you're experiencing mental health, if you need help, mental health resources are available across Canada through the Healthline at 811, basically 811. The federal government has a toll-free number for First Nations Inuit people who are experiencing mental health issues, which is 1-855-242-3310. For further one-on-one counseling, you can visit the agency seen here on this slide to find Black or culturally appropriate mental health resources. And this is the end of my presentation. So I just want to say thank you for listening to this presentation. Enjoy the rest of your day.